Hello. Hi, this is our patient from gastro office. She just underwent a peripheral nerve evaluation for sacral neuromodulation. This is a new procedure that helps patients with fecal incontinence and urinary incontinence. And since we had a lot of patients, that way we started doing it on patients at a trial procedure where you put in the leads in the back like for 5 days, and then you take out the leads at the end of 5 days. So when the leads are in, there's a little electric impulse that goes through an attached device, and it keeps the sphincters in the bottom together so that you don't have that bowel leakage and urine leakage. So she had results, and she just came back today for a follow-up visit. Erlene, right? Erlene is the first name.
Yeah.
So Erlene, yeah. So what was the most important thing you noticed in these 5 days? What improved?
My whole life's improved. I've been able to stay out of the bathroom. I lived my life in the bathroom for years, and I'm very happy with how this has affected me. None of this, if you haven't been through what I have, none of it is that painful that you wouldn't have results and see some improvement, because I see a lot of improvement, and this means a lot to me.
So she had specifically with regards to the bowel movements, how many times were you going to pass stools like before?
Well, I had spastic colon along with all of this, so this created me feeling like I had to go to the bathroom all the time. So I was in the bathroom a lot, whether I did anything other than just spot, but if I went to shopping or anything, trying to push the buggy, the stress of it would cause me to release in my pants, and I wore pull-ups or panties. There were diapers like, and I went through a lot of those.
So on this thing, there's 5 days, what did you notice, like with stools?
I've noticed that has lessened a lot. I'm down now to where I just do like a normal person. I just go to the bathroom and I'm done. I don't feel that
awesome.
pressure. And I don't feel like I'm going to go
Right.
every time I turn around. If I'm cooking, I have to drop everything and run to the bathroom. Turn everything off.
Yeah, so same thing, tell us with your urine. What happened with your urine? How many times per hour would you pass before they got this one?
I leaked all the time. It was just non-stop.
And now with this, when 5 days, when we did the trial.
That's changed. I'm dry. I don't leak. So.
And how many times did you pass urine, like when you had this?
When I get into a cough, because I have COPD on top of this, and I go into coughing fits with my lungs, and bronchitis, but that causes me the pressure. It makes me like normal people my age. You would lose a little urine, but none of that all of that's changed. I don't get that as bad now. It doesn't really leak like it did, and I'm dry all the time now.
That's awesome. And then you're able to sleep better?
Oh, yes.
Yeah, she was
Not
getting
up and down all night.
She was waking up to pass urine and stool, and that improved a lot.
Mm-hmm.
So overall, you think like this thing is something that works, right? At least in your case.
Yes, it's a game changer. You will see a big difference.
Right.
And it isn't that painful that you can't do it. You can, and it means a lot for a woman, because a woman we like nice things, and to keep herself nice. And if you could stay with this, you'll be able to do a whole lot better.
Yeah. And the battery life, this is a trial procedure that we did. It's for 5 days. Mm-hmm. And then what we do is we assess. The company gives us a recording of how much electricity you use, and then we'll ask you to maintain a diary with all the symptoms that you had, and then you'll compare with pre versus during the process. If there's significant improvement, we generally refer out to get an actual implant, which is the size of like a quarter. It's like a metal implant. They put it under the buttock, you wouldn't even notice swelling in that area. And then they pass some leads underneath going to the same muscles that it was doing during the trial procedure, and that's how it stays inside. And the good part with this new therapy, and this is the company that makes it, it's called Axonics. And this one, this device actually stays in for 15 years, and it has an extended battery life. So even if it requires recharging, you could do it from outside without having to take the whole thing out like another surgery and then put a new one back in. So it stays for a long time. So that's a significant improvement. And since in our practice we have so many patients like Arlene who have significant issues and they don't even bring it up with the physician when they come in. And I found this therapy to be extremely helpful, and she's a real life example.